Welcome back. You tuned into the Health, Wellness and Wellbeing Hour live on Chalk Hill Community Radio, the station that keeps you connected. And you were just listening to Smooth by Lena. Now, today's conversation is tagged From Awareness to Action, Black Men's Health and Prostate Cancer. And joining me on the conversation to make this make sense is Jay Williams. Jay's the Black Health Equity Engagement Officer at Prostate Cancer UK. In his role, Jay advocates for men, particularly Black men, to understand and check their risk of prostate cancer. He His work fills him with pride because it allows him to contribute directly to reducing the impact of the disease on men, families, and communities. Alongside this, Jay is also an experienced fitness coach who has spent the past 8 years working across various community well-being programs. He therefore brings valuable insights into health awareness, prevention, community engagement, and the importance of meeting people in spaces where they already feel comfortable and trusted. Jay, a very warm welcome to the Health, Wellness and Wellbeing Hour, and thank you so much for joining us.
Thank you for having me.
It's a pleasure. It's a pleasure. So, Jay, so let's start off. Tell us, please, about your role. What does your role involve, and and why does this work matter to you?
Yeah, thank you. As you mentioned, I'm the Black Health Equity Engagement Officer for the charity. And I thought I'd just break down the title, really. You know, sometimes people are given titles. So specifically the Black Health, I think there aren't a lot of charities that have specific teams or members of staff, you know, dedicated to certain communities. So, you know, when I joined the charity about 7 months ago, that was definitely something that attracted me because I've worked quite, you could say, holistically across various different cultures or backgrounds. So this is something that I really enjoyed, you know, speaking and engaging with the Black community. Also equity. I think this is the really crucial part, especially when it relates to prostate cancer. You know, we're really looking at the disparities of this condition, even disparities within treatment, seeing, you know, there's inconsistencies between the treatment that someone might receive in one area of the country versus another. So again, we're hearing some of those experiences, feeding back and seeing what we can do. And then lastly, when we talk about the engagement, that is, as you said, going into those, you know, those spaces, whether they be, you know, related to faith groups, community settings, and really engaging with the men and, you know, spreading that awareness is something that I'm really, really passionate about. So why does it matter? You know, I think ultimately, you know, to put it out there, it is life and death. So if I can play my part in just educating men and in understanding their risk and helping them through that journey, then I think I've, you know, made a difference.
Yeah, good stuff, good stuff. And thank you so much. And one thing that I always say to community health champions is that thank you so much for the wonderful work that you are doing in the community. Jay, please, why is prostate cancer? Why is it such an important issue for Black men in the UK? I mean, it's beyond, it's not just the UK, is it? But why is it just such an important issue at the moment?
Yeah. So you're right in saying that, you know, it's not just in the UK, but something that we always have to put across is that the 1 in 4 stat is specific to the UK. So of course, prostate cancer affects various different countries, but we might not have the data to actually quantify that. So just something to put out there, that 1 in 4 stat is for Black men within the UK. So why it is such a big issue is because, first of all, we are at a high prevalence than other demographics seen in the UK. So almost double, you know, white men and other demographics, you know, it changes very depending. So, you know, I say that not to be, not to is it fearmonger. No, that's definitely not, you know, the thing to put out there, but it's actually to make men aware that action is actually needed. Very much so, because as with any cancer, but particularly with prostate cancer, if found early, then, you know, your treatment options and your health is going to see better outcomes. So that's definitely something that we want to put out there. So yeah, I think those would be the main reasons why we think it is such a a high priority for our charity. But yeah, also to break down barriers within our community, reduce stigma. But yeah, ultimately that encouraging that early diagnosis and ultimately saving lives is why we focus on Black men.
Yeah, absolutely. Good. And you've mentioned that 1 in 4 stat, and how should we understand the 1 in 4 risk figure without necessarily creating fear?
Mm-hmm. So, I mean, there's a couple ways you could look at it, and the way that I often look at it is fear comes from the unknown. And because we have the stats, we might not know why we are at a high prevalence. There are studies, there is research that is going out to try to understand why we're at a higher prevalence, but at this moment in time, we don't have the answer. So I think the thing that we can do to kind of decrease fear is to think about the controllables. What things can we control, in our day-to-day life that can give us some sort of element of, taking our health into our own hands. And, for what we know at the moment, catching it early is the best case scenario. If we catch any cancer at the earliest stages, 1 and 2, we know that it hasn't spread, we know it hasn't metastasized, or various other things that can happen at the later stages. So again, you're probably going to get sick of me hearing it, but again, it's about empowering men. It's about making them, have the control in their hands.
Yes.
As possible.
Yeah, good. And what would you say to someone who hears that stats and feels anxious about it? The 1 in 4, yeah.
You know what? I would say speak to men. That if it is anxiety, speak to your community, speak to your healthcare professionals. You could reach out to our charity, and by as I said, by having the knowledge, prostate cancer is one of the most survivable cancers if caught early. So that's another thing that I would say, if you feel very anxious about it, and a lot of men are, because they can see the prevalence within the community or within their own family groups with various men, coming down with this disease, and it can be anxiety filled. It definitely can be. But I would say, the more knowledge and more power that you have, hopefully that anxiety would come down. Like, for example, we have something called like a risk information service run by Prostate Cancer UK. So this is for men who are just curious. They might say, I've just gone for my PSA. I haven't even heard my results back, so I don't even know what it's going to be. Can you give me a little bit more information? Or it might be somewhere else down the pathway. It might say something down the lines of, the PSA is elevated. What happens next? Generally in the UK, the next step would be going for an MRI scan. So again, it might just be explaining that process where potentially your healthcare professionals might not have the time or the capacity to do so in the way that you would like. We can all appreciate that NHS might be stretched and various other things. So I would say seeking your knowledge from various different sources. And as I said, maybe people that who might have already gone through the process might just settle those anxieties.
Yeah, absolutely. Good. So let's talk about diagnoses, particularly early diagnoses. So why is early diagnosis so important? And why can waiting for symptoms be so dangerous?
Yeah. So I'll touch on the symptoms bit first.
Yes, please. Yeah.
And so the way that I think a lot of men run is, if I don't feel unwell, then I should be fine. All right. And that I think that applies across various different cultures that I've worked with. So sometimes it can be hard to say to someone who doesn't have any symptoms that you still need to go. All right. But unfortunately, the way that prostate cancer works is there are a lot of men who have had no symptoms and still have prostate cancer. And what we actually do see is that if you have to wait for symptoms, then that actually could be that the prostate cancer is at an advanced stage. So we kind of flip it on its head and say, be proactive with that, rather than waiting for symptoms, especially if you have family history, right? If you're around, I would say the age of about 45 onwards for Black men, that was when we would encourage them to go for their PSA blood test, which definitely we'll talk about a little bit more. But that is the main source of testing that we have in the UK, is the PSA blood test. There is also something called the DRE, And the DRE is your digital rectal exam. Now, there are a lot of men who have stigma around that, or various different opinions around
Yeah.
that.
Yeah.
So again, something that we advocate for is, again, you don't have to have the DRE if you don't want to. You can simply have a simple blood test, and still begin that the process of diagnosis.
Okay. All right then. And how does early detection itself, how does that change outcomes?
So firstly, it changes it because you have more treatment options.
Yeah.
Generally with a later or more advanced prostate cancer, you're going to have to use harsher and more extreme treatment options. So that is something that unfortunately is the case if it is later down the line.
Yeah.
The other thing is, for some men, if prostate cancer is caught early, because we could view it as more time, you might be put on something called active surveillance. Now,
Yeah.
active surveillance is simply another term that is used is like watch and wait. So
Okay.
we'll be observing the prostate cancer. So we know it's present, but we're observing it to see, is it growing at an aggressive rate? Is it slowly? We'll be observing it, and then potentially, or not even potentially, your GP would be inviting you for regular PSA blood tests to see if there were any changes or growth of the prostate. So in a way, what we don't want to do is to there's a little bit of discourse around over treatment. So that's one of the things that is spoken about. So it's not the case of, oh, well, we find prostate cancer and immediately we want to remove it. That might not be the most effective way of treatment for every man, because there are a lot of there's a lot of side effects that could come, from removal of the prostate or various different treatments. So again, I'll just put it as, if we do catch it early, we just afforded so many different more avenues of action. So I think that's the main thing that we would say. But let's say something that came up very recently was the idea that cancer is bad, right? I think we can all acknowledge that.
Yeah.
But it doesn't mean that the most radical course of action or treatment is the best case scenario for every man.
For everyone.
So you have to look at it on an individual basis, I would say.
Okay. All right. Wonderful. Thank you. So it's important to get checked early rather than waiting for symptoms to appear. So by the time symptoms appear, you said that the condition itself would have spread.
Potentially, yes.
And it reduces options, doesn't it? Yeah. All right, good. Thank you for that, James. And you touched on the fact that men, once they touch the age of 45, that they should make sure that they're paying a lot more attention. So why should Black men, particularly age 45, what should they do, and why should they do to look into that risk?
Yeah. So there's a couple avenues. Let's say, for example, you were just curious about it. I mentioned a little bit earlier, there is a phone line for our charity. So you can find that on Prostate Cancer UK. You can ask questions if you want to, as I said, eliminate some of that anxiety before you start the process. There's also something called our risk checker, which has recently been refreshed with some of the most accurate and up-to-date information around testing, about risk. So again, for some men, they need a little bit more information before they start the process. So no problem with that. But if you're already at the stage where you've decided, I want to take action, then the first step would be going to your GP. So go to the GP, asking for a PSA blood test. And it's really important to understand that the PSA blood test is not included in a well-man test. So I meet loads of men who say, I've been to my GP. I went last week. I went 2 months ago. I went for my cholesterol and various other things. I should be fine. They would have flagged something if it was, elevated. But for a lot of places, the PSA blood test is not included and it has to be requested. So this is something that we definitely say to men, please ask for this PSA blood test, especially if you have family history. So family history is one of the other risk factors. So we spoke about age being one, from the age of 45 onwards.
Yeah.
But if you have, those close relations, your fathers, your brothers, your grandfathers who have had prostate cancer, also looking at the age in which they've had prostate cancer. There's a link between all different cancers and age being a really a key indicator of like
Mm-hmm.
similar age of diagnosis between different generations. So that is also another indication of, you know, where I should be maybe more heightened potentially.
Potentially.
So again, we are talking about risk. We're not talking about certainty. You know, so this is the other thing when we talk about fear a little bit earlier. There's no certainty in life. Doesn't mean because a family member has had prostate cancer that you will 100% get prostate cancer. So, but it is a case of, if I know that this is prevalent within my family or my community, maybe the best course of action is just to go for the PSA blood test, get that level of certainty, you know, while I can, you know, with those things that are in my control.
All right. Okay. Awesome. Good stuff there. So let's expand further on that PSA test. Please explain what does PSA stand for? What is it? And what should men understand about it?
Yeah. Okay. So the PSA blood test is sorry, you're testing me here. Is prostate specific antigen test. So that's what it is. Okay. So it's just a simple blood test taken similarly as any other blood sample would be taken, but it's measuring the level of protein produced by the prostate. So I think one of the main things that we do put out there is that it is not a direct indication that prostate cancer is present. All right. There are other conditions that could increase or elevate your PSA blood levels. So there's infections that could do it. There's even 48 hours prior to going for the test, if you're engaging in sexual activity, that could temporarily elevate it as well. So we would ask men to refrain from sexual activity before they go for the blood test. So there's various different things that could increase it, but I'll put it out there. I think that it is slightly an imperfect test, but that does not mean that it isn't a good starting point for diagnosis anyway. Because as I said, there's no medical profession in the UK that is simply going off that test and then diagnosing you for prostate cancer. There's various different steps in the pathway that go after that. So as I said, at the moment anyway, is the best tool that we have. So as I said, if it is elevated for whatever reason, it is likely that then you'd be invited for an MRI, which then scan the area, scan the prostate, and then be able to kind of map out if there are any abnormalities within the prostate.
Okay. All right. Good. And are there, in your experience, what are any barriers that you might have seen stopping particularly Black men from coming forward?
Yeah, I think stigma. And we hear stigma sometimes, and maybe that can mean a lot of things, to be very honest with you. So I think one is we see men who have been diagnosed, and they sometimes cannot tell their family members, or especially the male family members who might also be affected by prostate cancer later down the line. And there's various different things, because there's some severe side effects that can come as a result of treatment. So maybe it's embarrassment, it's fear of the unknown, it's stigma, your masculinity is involved in that. There's various different elements that could feed into that big, maybe overarching word of stigma, for example. And even I think there's even just stigma in the testing. I mentioned a little bit earlier about the digital rectal exam. There's stigma around that. I'm not going to isolate any particular communities within the Black community, but I think we all have heard some of the tropes that are used. You could say that's the best way I can put it. But again, I think hopefully we're getting to the point where there are some people that say, if let's say the DRE was the only way to testing, all right, would that not be worth it to save your life, to give you another 10 years, 20 years, in case you have to look at the trade-offs. Now, I say that every man's health is their own priority. So what they choose, I completely respect. But I would advocate to them just to say that, there is a bigger picture in terms of your health, and advocating, what is going to save your life. And I think just to expand on that as well, there's another element that sometimes I see, which is maybe across all men, which is like men don't talk. That's another barrier. Men, people say all the time, men don't talk.
yeah,
But
yeah, yeah.
I personally think that is untrue. And the reason why I say that's untrue is because if you give any man, especially black men, the opportunity, the space where they feel comfortable,
Mm,
and there's trust in that space, in that safe environment, I think they will open up. I think they will share things that they're going through. So potentially it's about safety. So yeah, hopefully, when men, meet their family members, their friends, whoever, they can identify those people that they feel safe around. It's not
yeah,
for me or anyone to dictate who that might be, but
mm,
hopefully they can identify that and share your experiences if you are
mm,
going for it, and I think lastly, I would say is I think this is across all generations or whatever, people share the negatives more than the positives.
yeah,
If
yeah,
something bad happens in your day, you're going to share that. But I would say to men, if you did have a positive experience, also share that side, because
yeah.
then that might
Of course.
encourage someone to say, "Oh, it wasn't that bad. Oh, it
Mm,
wasn't, it wasn't as bad as I heard this person say." So then that might encourage them to then, advocate for their health in
yeah,
in any circumstance, not just prostate cancer, because I'm aware that there's various different health conditions that affect the black community that probably need attention,
yeah, yeah,
so I would
yeah,
advocate for all of
yeah.
those.
Absolutely. Good, 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 good. So emotional safe spaces, great
Yeah.
way to kind of break down those barriers and hopefully get men engaged. Good stuff. Um, let's talk about distrust. And again, we've kind of touched on that already, haven't we? And that's also, it's a big issue that can't be overlooked. How do
Yeah.
we talk about distrust in healthcare honestly, but constructively?
Yeah. um there's we could have spent probably the whole conversation just speaking about this, to be very
I
honest.
know, I absolutely know. Yeah, yeah.
Yeah,
Mm,
distrust is a big thing,
mhm,
especially within the black community.
mm,
I think we all want to be we all want to feel the sense that the system is working for us and not against us. And maybe historically, there's been many different examples where it hasn't been the case. And I think one of the things that drives that is probably deprivation. We do see across various different health conditions, but especially prostate cancer, areas of high levels of deprivation do see worse health outcomes, and particularly how that relates to prostate cancer is we see later stage diagnosis. So again, that's one of the the we kind of chalk that up to something called like the postcode lottery.
yeah,
you
yeah,
know
yeah, yeah.
um so in those areas, are the people being given the best resources and
Mm,
opportunity to succeed? And oftentimes, the stark reality is probably not. So again, maybe what I would say is empowering ourselves. I think the black community can very much and is probably used to taking the initiative, similar to the invitation to come here today.
yeah,
I see that as a great opportunity for us to spread the awareness ourselves,
mm,
and take action. Um, but just to go back a little bit into the distrust of healthcare systems, I think we can look at how can I ask for fairer treatment, and one of those key things might be there are some men who've been refused the PSA blood test.
yeah, yeah, yeah.
So as I said a little bit earlier, understanding my right and saying, well, no, I'm 45, I'm a black man,
Mhm,
I've got a family history, I am
yeah,
entitled to this PSA blood test.
yeah, yeah,
You
yeah,
know, if that person says no, there's various different avenues you can go down, asking
yeah,
for a second opinion, asking them to put it in your NHS notes so it's documented. There's various different avenues that I would advocate for that person to go down to, just to make sure that they feel
yeah,
comfortable in advocating for themselves.
yeah,
Um, so yeah, those are some of the elements that we see when it comes to distrust. Yeah, I would say find different areas where we can get uh, accurate and safe information throughout.
yeah. All right, good. But Jay, so how do we balance that out with over treatment? Because you mentioned over treatment earlier on, didn't you? So
Yeah,
how do we balance it out to make sure that things are balanced?
yeah.
Mm,
Over treatment is
mm,
is a big thing at the moment, to be very
yeah,
honest with you.
yeah.
Um, and I wouldn't necessarily say that I'm the best person to address it, only because
Okay,
only because I'm not a healthcare professional, so to
okay,
speak.
right.
But what I would say with that is the way that I see it is with the testing element, we are at least opening the door to the right conversations being had. And then later down the line, your clinicians, your oncologists, those people would be the people to be having those conversations. So just to address it a little bit more into where I'm currently at in terms of, let's say there was a discussion of a testing program or a screening program, sorry, that's a proper term for it. So we were advocating for targeted screening of the Black community. And currently at the moment, there was, as I said there, it would say if we offered that to all men, there would be a lot of overtreatment because there'll be a lot of men who have low level or non-aggressive cancers that won't affect them or won't impact their quality of living. And therefore, the harms would outweigh the benefits.
Okay.
So with that, because they said there's a lack of data, one of the first things we can say to Black men is let's advocate to be part of research. So I think the stats for Black men and people of color involved in research is very, very low. So I think less than, too fair, actually, I wouldn't even say a stat, but it is low. So again, we'd say to men, please do get involved in research, and one of them is one that we're funding, and that is called the Transform trial. So that is going to be a very long trial. It's going to be over, I believe, a 10-year period, and it is specifically going to be looking at some of the best way to diagnose prostate cancer. So there's going to be various different pathways which men will be invited. So their GPs will reach out to them via letter, and then through that process, they'll be invited to be part of that trial. So that's something that I would say is how we can kind of eliminate those disparities, how we can eliminate the notion of overtreatment, because then through that trial, we will then find out what is the best case scenario of testing and hopefully the best way of eliminating the high prevalence within our community. And that's what I would say, to directly address that.
Yeah, all right, good. And in addition to that, is there anything particular that Prostate Cancer UK is doing to improve engagement within the Black communities?
Yeah, so I mean, now that's definitely my bread and butter. So I work within the Black Health Equity team. So we focus on a lot of engagement. So we have various different parts. So we've got my manager, Kevin. He does a lot of the engagement in London, and a lot of my work is in the West Midlands. So between us, we are focusing on reaching various different groups in the area. The reason why we picked the West Midlands, because it's got the highest, it's got the second highest level of Black people outside of London. So again, we saw there was a need to actively engage with Black men within the West Midlands. And within that as well, we are also working with healthcare professionals. So not only are we doing advocacy with the people that we meet, but also trying to implement some of that change within the healthcare systems. So that's something that we're actively doing. As I said, the engagement takes various different forms, the ones that I do, so that could be going to community events, presentations, fun fairs, cultural, celebrations and events, all with the message just to spread, testing and awareness to various different communities. Another really key part of this is partnerships. So when I talk about partnerships, is partnerships with like culturally relevant organizations and charities. So one of the biggest examples of this was the Mobos. And that's a really big activation for us, because we know we've got various different people, Black people from different age demographics, all engaging with this, celebration of music and culture. So that's a really big, activation for us. But there's various other, ones like the London Marathon. Lots of people run in memory of people. Various different fundraising events that happens up and down the UK. So we want to have a presence in them to spread awareness and also help, spread the legacy of those who are maybe no longer with us.
Yeah, absolutely. I feel like that's really, really important, because that's where awareness turns into real practical supports. And I think that's really, really important. Okay. Any particular resources or campaigns that listeners should know about, especially around the Midlands or in London?
Yeah. So yeah, I can definitely talk about the Midlands
Yeah.
work. So
Okay.
with that, we are currently in the process of a pilot. So with that pilot, what we're trying to do is emulate something that could hopefully be replicated in other parts of the country where
Mm,
we know that the prevalence levels are quite high.
mm,
Um, so with that, the process started with an audit. So we wanted to understand what are some of the experiences of men within the West Midlands. So again, we had various different what do you call it, sessions where men were invited to share positive and negative experiences. Some of them sharing things like, they wanted, some consistency between the consultants that they were seeing. Some of them saying they wanted better availability of appointments. Some of them saying they wanted the services to be closer to them. And then all of that information was taken and round up into a report. And this was done by a professional called Natalie Darko. So she works at the University of Leicester. And with that, she helped us produce a manifesto. And what that manifesto aimed to do was to get your various different organizations, such as like the Westminster Cancer Alliance
mm,
and your various different healthcare kind of like ICBs, which are like integrated care boards and various different things like that, to all work together to advocate for Black men and to reduce the prevalence of it and the impact that it has. So as I said, that early diagnosis, why
yes.
aren't men coming forward, and various different things. So that's been a considerable part of the initial parts of our progress there. Another part of that has been something called like a bridging fund. So with that bridging fund, it is about making money available for local organizations who are actively working with the Black community and allowing them to apply for pots of money to then, basically to do activities for their audience who we know that they'll be best suited to address, really.
Yeah.
So that's another thing that's been doing. As we said, there's various different activities that
Yeah.
happen in the West Midlands, such as like there's a festival called Simmer Down
Mm,
that our charity is going to be involved in, and various different culturally relevant activities we're looking to do. So that's been a lot of the work within the West Midlands.
mm,
I spoke about healthcare professionals a little bit earlier as well. So also training of healthcare professionals, so equipping them with the most relevant and sorry and up to date information. Oh, sorry. So yeah, with that, we hope to equip them with toolkits, resources, and information.
yeah.
Excuse
Yeah.
me.
Okay. No problem. Yeah. Good stuff. And I can actually testify to what you've just said because I received an email from, I think you mentioned the Kevin. Yeah, you mentioned Kevin there, didn't you? Yeah. I got
Yes.
an email from him about, the funds available for the work that I also do in
Yeah.
relation to addressing health inequalities. So yeah.
Yes.
So well done, guys. And yeah, keep up the good work. Keep up the great work. And also, in addition to that, trusted community spaces are also important,
Sure.
aren't they? Yeah.
Yes. Very much. Very, very,
Mm,
very much
mm,
so. I'm I'm pretty sure when I worked in different areas
yeah.
of health inequalities,
Mm,
maybe COVID was the first, maybe connected version of that, where we saw healthcare professionals, faith leaders,
yeah.
community groups, all trying to pull in the same direction. And I think it worked. I think for a lot of people it did work
Yeah.
to
Yeah.
sow the seed of trust. But with community spaces that specifically, we know that people feel a sense of belonging, a sense of
Mm,
support when engaging with their community groups, and being in that safe space. I think this is even more to the forefront with the Black community.
yeah.
So very much so, I would say we do need these trusted spaces
Mm,
to be funded. We need them to
mm,
be supported. We need our community to show up for them, to fundraise for them, to support in whichever ways we can, to volunteer for them. Whatever way we can give back to these spaces,
mm.
is important.
Yes, it is. Yes, it is. Absolutely is. So obviously we're talking about prostate cancer, which that means we're talking about men's health. But
Yeah,
we can't overlook the role of families and women,
yeah,
because obviously they also they're heavily involved in the conversation, aren't they?
yeah, yeah. So much so.
Yeah.
I meet a man a week who said, I wouldn't have even gone for the test if it wasn't for my partner, if it wasn't for my wife, if it wasn't for my daughter, you know. So we know the incredible contributions by women and by family members to advocate for their partners and their loved ones. So yes, very much so. I can't agree with that more. But also, you know, maybe another element that I want to say is that, you know, we need to support them as well. You know, there is a lot of emotional maybe hurt or, you know, baggage that comes with, you know, supporting someone who's going through maybe a cancer diagnosis. So as a community, can we support them as much as they are advocating for us? You know, so almost make it like an equal exchange, so to speak. You know, and I think another thing that can, you know, maybe even support with that is a service that we have, which is called a peer-to-peer support. So with that support, men are paired with other men who are also going through the journey. So, you know, that could be just something that takes a little bit of pressure off a family member, because then you are putting a man who's going through a diagnosis in touch with someone who's recently gone through it, knows, you know, what some of the, you know, outcomes are going to be, what some of the conversations are going to be like, you know, and just that can also help reduce anxiety. And, you know, I've seen, you know, people, you know, partners and families all jump on the call together. They're all having a conversation because different people have different questions from different angles. And also we do see that sometimes men, you know, who are going through the treatment, maybe it's very overwhelming for them in the moment. So maybe they won't retain some of the information. So having those family members on the call with them can also be a really, really helpful step. So yeah, we can't understate the value and the contributions of women and family members.
Absolutely. And do you think, is there a good way to kind of start for a woman to start that conversation with, you know, with a loved one from their family or their partners? You know,
Is there a good way? That's a good question. I think looking at it maybe from an element of love, you know. So, you know, that's an element, you know. So again, like I've seen this, or I've listened to this radio show, or, you know, I also think maybe humanizing it. Oh, I saw this person down the road, you know, I was speaking to them, they mentioned it, you know. So rather it being like an instruction for you to do, or something else that's on top of all the other things that's going on in life, it's a case of, oh, I'm looking out for you by potentially, you know, starting that process of going down the line of going to your GP. I know some people who maybe are more proactive, so to speak. And what I mean by that is they're calling the GP on behalf of their partners or their whatever. So they're even skipping that first barrier. So again, I think it really depends on the person, doesn't it? But what I would say is, yeah, you know, I would put it out in a loving way, because I would assume that that person would receive that in a much more delicate and accepting way if it was put through that lens.
There's a question I just want to quickly take us back a bit to the PSA. So if a PSA is good, and when necessarily would be the next time that you should do a PSA?
I mean, there isn't any exact guidance on that, to be very honest with you. If it is elevated, and, you know, I mentioned about the watchful wait or active surveillance, as it's called, you might be invited to come in 3 months, in 6 months, potentially. But if there isn't, you know, any elevation, it might be a year, it might be 2 years. It really depends. I would really actually ask the healthcare professional who you're engaging with when might be the next time, because it can be also, age can be another thing that does determine that.
Absolutely. All right, good. Thanks for that clarification. Okay, so now, what practical step do you think listeners should take after hearing this conversation today?
I think first of all, advocate for yourself. That's on any health condition, especially in the Black community. Please do. So, you know, whether that's diabetes, whether that's, you know, high blood pressure, so hypertension, prostate cancer, please look into all of these things. So again, engaging with your GP is going to be the best course to do that. But yeah, generally I would keep it short and sweet. I would say, let's understand our risk. So what I mean by that is we spoke about age being one of your risk factors, your family history being another, and your race or demographic. Those are the three main risk factors that we currently know. So if I know I'm Black, if I'm over the age of 45, and if I have a family history of prostate cancer, and something I actually missed, that I'm glad you actually asked that, is it's not only a family history of prostate cancer, it can also be a family history of breast or ovarian cancer in your female family members.
Yeah, yeah.
So that is another key element that we want to put across. Okay. So if we are, hitting any of those risk factors, then be conscious of it. Look out for it. And as I said, ask for that PSA blood test once you are over the age of 45 for Black men, or over the age of 50 for other demographics.
Okay, all right, good. And I know you mentioned the resource for the Midlands, but generally, anywhere part of the UK, maybe London, where can listeners go to maybe for more information or support?
Yeah. So it would be our website, which is Prostate Cancer UK. So yeah, if you just type that into Google, our website will come up, and there'll be various different resources that you can find out. There's so many different resources that we have. One of them being our specialist nurses, and I can't understate how great they are. Our specialist nurses who answer various different questions at various different times. So you could be newly diagnosed, going through diagnosis or treatment, or you can be 5 or 10 years post-diagnosis, and treatment. It really doesn't matter when that person engaged with those services. So I definitely would promote that. So again, our services are UK wide. If there are like community groups who want to engage with our Black Health Equity team, they can reach out to us. So you can reach out through there's various different ways. So like there's like a supporter line, for example, and they can pass on your email potentially, so we can try to attend events. Or we can send resources that you can distribute amongst your community, that being another one. So actually, there was something that I just wanted to clear up slightly. So I mentioned there was a bridging fund, and that's in the West Midlands. So that one is soon to be launched. But what you would have seen, Charles, is a UK-wide one. So that one is just called like a community grant. And that is available for anyone in the UK, a CIC at a minute, so a CIC or a charity who wants to put on some sort of activation for the Black community. So again, it is, as I said, for the Black community, for Black men specifically. So if you are engaging with those groups and you would like a pot of funding to equip you to do that, please do have a look. We can circulate the details, but it is being circulated online as we speak. So yes, please do check it out. I would advise everyone to.
Okay, good. Very resourceful, very resourceful. Thank you. And Jay, as we begin to wrap up, please, what's your final message to Black men listening, to families? What would be your final message today?
My final message is one of advocacy. My final message is one of taking health into your own hands, advocating for yourself. As I said a little bit earlier, a risk factor is not a definite. Just because we're 1 in 4 doesn't mean you will get prostate cancer. But what we do know is that if we are not looking into it, if we're not checking, if we're not at least giving ourselves that peace of mind, then we are more likely to receive worse health outcomes. As I said a little bit earlier, worse less treatment options if we do have more advanced prostate cancer. So, my thing would be, the first step is having a PSA blood test. That is the best first step that we have at the moment. That might change in the future. Something else might be developed that is more accurate, better. That equips us to save lives. But for the time being, anyway, it is the first step that we have. So what I would say is, do those two steps that I just said. But maybe the last point I would say is, if men feel comfortable enough, and if they are brave enough, and if they do have a diagnosis, please share that. please share that with your your close
yeah.
family members, because too often we hear it's only until someone, let's say I'm diagnosed, I share that with my close family members, that's when then they share it, and they've had it 5 years ago, 10 years ago. But their diagnosis could have potentially saved me from getting it at a later stage. So all I'm promoting is communication, speaking about it, have it in often and common conversation. Oh, I listened to this radio show, they were talking about it. Oh, I saw it on the news. Oh, I saw this poster. Bring it up. Let's normalize it. Let's not keep it in shame and fear where, as I said, these things are not spoken about, and then people feel almost embarrassed to bring it up, that they're going through something. So those would be my takeaway messages.
Okay, awesome. Thank you so much, Jay. Thanks for such an open and informative and important conversation. And I think today's conversation has reminded us that prostate cancer awareness is not about creating fear, but it's about giving men the knowledge and confidence to make informed decisions. Some of the key messages from today are clear. That even though around 1 in 8 men in the UK will develop prostate cancer during their lifetime, but for Black men, the risk is approximately 1 in 4. Black men should understand their ethnicity, their age, their family history. All of these things can increase their risk, as Jay has emphasized. Early prostate cancer often causes no symptoms, so waiting until something feels wrong may mean waiting too long. Black men are also encouraged to speak to their GP about their individual risks from the age of 45 and earlier, and if they do have concerns, or family history. The PSA blood tests can help identify whether further investigation may be needed, but men should discuss its benefits and limitations with their GPs. And also, finally, this conversation belongs to all of us, parents, relatives, friends, community leaders, and health professionals. All of us can help in creating conditions in which men feel able to speak, ask questions, and take action. So, Jay, thank you so much for sharing your knowledge, your
Thank you.
experience, and most importantly, such a clear message about the difference that informed and timely action can make. Thanks so much.
Thank you.